All right, boys, we're gonna knock out 10 more slides today. We'll finish off male reproductive anatomy and then get into female reproductive anatomy next class as we move forward. Anybody else found any irony in respiratory viral transmission at the current time? And we're going to eventually talk about sexually transmitted viruses, and I don't know, find something going on with that. Seminal vesicles. These guys exist kind of midway through the chain of events that occur during ejaculation. It's right here. All right, they're going to produce the majority of the semen for ejaculation. They carry the sperm along the way. So 60% of the semen is produced here. One of the greatest roles of this is to fight vaginal pH. So essentially, female vaginal environment is relatively acidic to fight off any bacterial invaders that occur in a woman's lifetime. And sperm are considered a foreign invader, so they have to have their own defense mechanisms and actually beat the female's test. You could consider that to just be like trials. Weak sperm aren't going to get through, and that's kind of what we want to happen. It also has fructose, which is a sugar in the semen that through diffusion will give the sperm fuel to swim into the cervix and onto the fallopian tubes. So prostate also exists in that same region. Seminal vesicles pass through it. It's right here. Tubuloalveolar, if you can remember back chapter 6, when we're talking about epithelial tissues and glands. This is tubes, and it's a bunch of tubes, right? Not like a large amount of tubes, but a bunch, as we would use bunch in grapes, right? So a gland shaped like a donut, watery, milky, and slightly acidic secretion, around 30% of seminal volume. So if you're doing the math at home, 60 and 30 is 90. The majority of semen comes from seminal vesicles and the prostate. So also provides citrate, another nutrient. So citrate, fructose, water. It's a nice cocktail for the sperm to swim in. Right in that area as well, bulbourethral glands, they're called Cowper's glands, these two here. And their major role is to keep the alkaline fluid flowing, which is going to, if you remember in your chemistry, and you juniors will know chemistry a little bit more rationally right now. Seniors, you're trying to remember it. Acids and bases combine to bring neutral, right? If they're in the same strengths and molarities and so forth. But if we consider the vaginal environment to be acidic, then alkaline fluid secreted here would sort of counteract that inside the semen. Remember that sperm are swimming through semen, and it's important that in doing so, they are protected from the outside, okay? Also, this is another role here. I forget if we've mentioned something like this before, but I want you to imagine yourself going down a water slide with water flowing versus a water slide with no water flowing, and you tell me which one's going to turn out better. So in that case, the bulbourethral gland is responsible for pre-lubricating. This is not what you're thinking, but it's pre-lubricating the urethra so that as the semen flows through it, it flows even more smoothly as a protective function of what the bulbourethral glands do. Inside the scrotum, we've got the testes are going to be in there. They're divided by a septum in that scrotum, so which is it's a wall essentially. So left and right testicles are separated by that septum. During sexual arousal or colder temperatures, we have some muscles that are located. This is not the image for that. It's going to be this one. These muscles here, the cremaster muscle attached to the spermatic cord, they are responsible for constriction and pulling back on the testes to regulate body temperature and or anything rigorous that could harm the testicles, right? So the scrotum will elevate at that time. So the temperature piece, the testicles are supposed to be approximately 3 degrees Celsius in the neighborhood of around 5 degrees Fahrenheit, cooler than core body temperature. So that's why during different temperatures of outside or inside environments that our bodies will adapt accordingly to keep the testicles right temperature. Remember, biologically, we're here to reproduce. So every feature of our body is designed to keep us alive, keep us healthy, and keep us reproducing. Penis kind of know what that is, right? Major reproductive component in the male anatomy. The spongy tissues that will allow blood to flow, the corpora cavernosa and corpus spongiosum, they're located here and here, right? So, and remember, this is a longitudinal section, so we're looking down the shaft here. So there's another half of this missing that's on top. So it is circumferential. It surrounds the urethra. And during arousal, which is chemical based, the blood will flow here. The arteries will dilate, allow more blood to get in, but the veins will not change their diameter at all based upon chemical input, which means more blood is getting in, but only a normal volume of blood can get out. That's where the erection comes from. So essentially, it's an increase of pressure due to inability to get blood out of the penis. Glans penis, commonly referred to as the head, is the structure at the tip. And then foreskin is referred to as prepuce. It's located here. You can see on either side of the head of the penis there. Western culture, we cut this off as a result of, prior to this period of time, increased number of infections and then possible just religious beliefs and so forth. So obviously you know what the function is, and I mentioned erection already. So we've looked at this. That's good. I don't know if anybody sees what I see here, but when I do this, do you see? Oh, that's not what I wanted to do. Scratch that. When we do that, do you see an alien? Alien when I look at that. Anyway, this is the 100% of contributing structures for seminal fluid. I told you before, seminal vesicles are around 60% of seminal volume production, 30% are in that neighborhood of that fluid comes from the prostate. The testes and epididymis, a limited amount, as well as the bulbourethral gland. But what I wanted to do was kind of draw a line here. And in a vasectomy, seminal volume is only decreased by around 5%. The sperm don't get out, but seminal volume remains approximately equivalent. This is all after the vasectomy here. Okay. Male fertility is functionally described as 25 million sperm per milliliter, and that results in a mathematical problem that exists for reproduction. Essentially, not enough sperm are produced, not to fertilize, but to finish the fight, and then by the time they reach the egg, there's not enough sperm to perform the act of capacitation, which is when the sperm's heads open and release an enzyme that's going to break down the barrier of the egg wall. So that's what's stated here, right? So what's normal in healthy sperm, 50 to 100 per milliliter. So that's either 2 to 4 times more sperm than a person who's considered to be functionally sterile. If we consider an average ejaculation being around 2 to 6 milliliters, what we're saying is low sperm count is still 50 million sperm per ejaculation. That's a great deal. But on the high side, 600 million sperm could potentially be present. So 600 million versus 50 is 12 times more. So you see the difficulty of sperm in reaching the egg and then capacitating and fertilizing the egg. So it's strength in numbers. The analogy I like to use is like from medieval times. I'm not going where you might think I'm going here, but if how many soldiers, foot soldiers, does it take to breach a castle wall? If you consider the egg to be the castle wall, it takes the efforts of many soldiers, battering rams, trebuchets, catapults, to finally break down the door, the wall, get over the wall. It only takes one to kill the king, though. But the collective efforts of all of them get that one sperm into position to do that. So enough sperm have to be present to break the egg down with chemicals for that one sperm to push through that last barrier. So enough sperm have to be available. What can go wrong? Oligospermia is decreased sperm production. That's the term I'm using to describe what we just talked about. This can be the result of any number of factors, which are listed here. Obviously, infections, fevers, and trauma, physical trauma, high temperature. One of the things that some males have to do in times of lower fertility is to wear certain types of clothing to release the testicles from being too close to the body. So cooler clothing during warmer months. Cryptorchidism is something that can happen mostly in young people, and the testicles don't descend and they don't end up being suspended from above. They stay within the lower abdomen, and it can be cured with medical procedures. BPH, benign prostatic hypertrophy, benign, enlarged prostate essentially. So benign is non-cancerous of the prostate. Hypertrophy is increased growth. Okay, so 75% of men are going to experience some degree of prostate enlargement in their lifetime. So at about 40 to 50 years old is when this is going to start occurring. So we try to track this information in early 40s so that the doctor has data moving into a person's 50s, right? Puts pressure in the urethra. So two of the symptoms are painful urination and the effect on erection. Penis and scrotum. If the foreskin's too tight, we're going to refer to that as phimosis. And the glands or the head of the penis can't get back through it. So think of a turtleneck that's too tight. Circumcision can usually can cure this, but some cases, this is what we're talking about where circumcision is practical, is that if the foreskin's too tight, it can affect the way that the tissues interact and can cause some significant problems for the person that experiences this. So what impotence and erectile dysfunction are, inability to achieve an erection. In many cases, it's older men, and over time, the body gets older, so the function of the circulatory system is going to be diminished. But further, a lot of erection is caused by mental arousal. And as we get older, our brains have been through so many events and scenarios and anxieties and different bouts with depression and stresses, physiological stress and mental stress. And just getting bored with it, honestly, can affect the way that the penis can achieve erection. So it's important to remember that staying healthy is what we've preached all year, and this is one more reason to stay healthy. Okay, I know you're not thinking of 65-year-olds in intercourse, but yeah, guys, it still happens. Also caused by other factors. This is arterial function. Diabetes affects all of our systems. Alcohol abuse, slang terms for that if a person drinks too much. Medication, certain medicines can cause erectile dysfunction. Radiation, when you go to the dentist or you get x-rays, you wear your lead vest over your pieces and parts that you want to function correctly. Tumors that have effect on blood flow. Spinal cord trauma, no sensation to the region, and even surgery. Some surgeries, there's a full disclosure. If we're working in the pelvic region, we have to be careful. The doctors will tell us that in some cases, these surgeries result in loss of sensation to the sex organs. And I don't think anybody wants to hear that no matter how old they are. Hydrocele are scrotal swelling. So I usually will do something here with this. So what happens is the interstitial fluid leaks out into the membranes, and it actually causes a secretion, and then the scrotum will swell. You can see in this image here. And there actually is a procedure to fix this, but in this one you can see kind of the fluid filling into the area. It's not something that we want to happen, and that's usually the result of a traumatic event. And an inguinal hernias, this is when the intestines will leave their abdominal cavity and actually get into the inguinal canal. And the inguinal canal is located through this region. So they'll pass through here, see inguinal canal. The intestines, which will be resting up here, can kind of find their way into the tear and then begin to push into the scrotum. And I know if you're sitting at home, that sounds terrible, and it actually kind of is. Look at that here. Back for the humor. This guy is not lifting that rock in any way that deems humanly appropriate. First off, he's only got a couple of fingers. It looks like his pinky finger's missing. And then who grabs a rock like this? Are his hands like supremely strong? Because there's no way he's holding this rock. But the worst part is that he's bent over in a form that's going to put extreme abdominal pressure. And if there's a weakness in the wall, let's move forward, the intestines can actually push through into the inguinal canal and then find their way into the scrotum, which we'll probably, as we get further down, find some images of this. You kind of see what's going on. This one would be an extreme. It says giant right inguinal hernia, and yes, that one is giant. But, that's a good example. The fascia has been torn, and now the intestines are pushing through the fascia, through the muscle, the abdominal wall, and into the subdermal space. There's a good example over there as well. So that covers that. And I think we have, what, one more? No, that was it. All right. So lifting heavy weights, having weak abs, not training your abs, and then making bad decisions on when and how we pick things up. Okay. 2 lessons. We're kind of right on pace to where we would normally be in class. I know I did this in 16 minutes. It would take maybe 45 minutes to an hour to do if you guys were live with questions. But we're not in that situation. So watch the video, as you've already done if you've gotten to this point, and work on your study guide. I'll see y'all at some point in the week of the 23rd through the, 27th. 3, 4, 5, 6, 7. Yeah. Later.